And once again, welcome back. We're here with Dr. Adam Reyburn from Quincy Medical Group answering your questions. Here's another one coming in, Doctor, right now from Dana Felker Chapman. Sent this question into our Facebook page. Caring for an elderly parent in her home, I try to be extremely careful about sanitizing and hand washing. Are there any other suggested things I can do? Can caregivers get any testing priority to ensure they are not carrying the virus? I'm truly frightened that I might bring it into her home.
Absolutely. I mean, it's an appropriate worry. Would somebody be more of a priority to be tested if you take care of a sick person? Most likely not. The key thing is good hand hygiene. So if you cough into your elbow, good use of hand sanitizer, washing your hands, trying to social distance yourself. If you're sick, don't go there. Find somebody else that can provide care to that chronically ill person, that old person.
Yeah, that's good common sense. Yeah, no doubt about that. Another question in from Megan Stone on Facebook wants to know, will local doctors be prescribing chloroquine and the Z-Pack for cases? I've been seeing in reports elsewhere that doctors are treating corona patients already with this method, and it's really improving symptoms. Is that true?
That's a great question. Last week I was the intensive care physician, and we kind of were, had to face with this matter in case some of our patients that we had come in with pneumonia, if we didn't know that they could be a COVID patient, we didn't know. And so who would be appropriate to be treated for that? First of all, the treatment it's very, very, very premature to know those medications work. The Plaquenil, which is the chloroquine, may reduce viral shedding. And there's some small data of like 10 or 15 patients showing that there may be some improvement with it. We're going to reserve those due to lack of supply for people over 60, people with respiratory illnesses, people with pneumonias, people in ICU settings. If you're a 20-year-old person with coronavirus, but you're doing otherwise fairly well, you're probably not going to get that treatment.
All right, very good. Another question in from Tina Allen. She wants to know, she sent in her question through our Facebook page, how common is loss of sense of smell and taste for mild cases? I've seen several nurse friends and an online news organization mention this. Is this true? If so, why isn't the information more widely reported?
Right. So obviously most viral symptoms are going to be fevers, chills, cough. But oddly enough, for this coronavirus, lack of smell may be one of those symptoms. I can't explain why that would be, but it is a potential symptom of that disease.
All right. We have another question in from Lynn Galbraith right now. She wants a question sent in through our Facebook page. Can unborn babies die inside a mother that has coronavirus? Does coronavirus leave side effects in an unborn baby like weak lungs, brain dead, or stillborn?
That question is a great question. I don't think we know enough about this disease yet to know what the effects would be on a fetus or an unborn child, at least in my knowledge.
Okay, very good. Another question in from Bailey Shear. She sends in another question to our Facebook page. She wants to know, I want to know why people with all the symptoms are being turned away. Do we not have any tests anymore?
Another great question. So we have a process in Quincy, kind of in conjunction with both Blessing and Quincy Medical Group, where you call into a hotline, and the person there will screen you for symptoms. And if you or somebody they're concerned about, they will recommend you go to the I think the 28th and Chestnut location to be evaluated. There you may be tested for flu, other viruses, potentially directed to the ER if your symptoms are significant enough. We're not forcing people away, but we're trying to select who to test for. Not everybody with every viral symptom needs to be tested for this disease.
Very good. Another question coming in from our Facebook page from Cinda Selby. She wants to know, if you had it once, can you get it again, meaning the virus?
Right. Well, you should not be able to get this species of coronavirus, but this is a very unique one. I mean, back in 2004, we had a disease called SARS. SARS was a disease, again, came out of Asia and very devastating in that part of the world, but that was coronavirus species as well.
Right.
So you can still get sick with different coronavirus species, but I would imagine that if you get